بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على محمد وعلى آله وصحبه أجمعين. We're looking at types of anxiety. We have looked at post-traumatic stress disorder. Today we want to look at obsessive compulsive disorder, OCD. It's another kind of anxiety disorder. It's characterized by two things: persistent, intrusive, unwanted thoughts that the person is suffering from and is unable to control it. And that is the one. It's a thought, unwanted thought that persists. And that's also, it contains the performance of some certain acts, rituals that the person performed many times. And these are many a time there is no connection between the intrusive thoughts and the behavior. Anytime. So there is no connection. The person just continue engage in that particular ritual and continuously to do it. Symptoms or obsessive thoughts usually concerned with contamination, harm to self, thought as if you want to harm himself or herself. It has to do with sometimes disasters, sometimes it has to do with blasphemous or violence or sex or other general thoughts. So, someone has one type of symptom or the other, and one type of rituals or the other that the person engages him or herself with. And it is done many a time, repeatedly. So, and this one affects their behavior. Late to program, late to work, late to school, and the like. Because of that particular ritual they want to continuously do. Washing hand every time, washing hand, as if the hand is contaminated, washing it, with the thought that that is there. I don't want to contact, to contact COVID-19. Wash, and this. The causes, according to what I said, biopsycho, social, spiritual issue. Some believe that what it is the biochemical theory. Has to do with serotonin in the body system, in the brain, that affect it. Some they believe that it is genetic theory. Maybe it is gained from the parents. Some they believe that it's learning theory. It is learned through conditioning. That part, obsession. The psychoanalytic believe that it is what? It is caused by unconscious conflict. And impulsive that from the conscious awareness. These are some of the theory, the causes of the obsessive compulsive disorder. There are treatments from the scholars, from psychologists have been put in place. You have behavioral therapy that can be used. So you also have medication and antidepressant family of drugs can be used to also attack it. And this is part of the thing that they can use to solve it. In Islam, obsessive compulsive disorder is a generally medical condition rather than relying on one thing or another. Islam encourages seeking medical help. Go to a medical doctor, go to psychiatrist, go to a religious expert. Go and explain yourself. Let them know the issue. What Islam use the obsessive compulsive disorder spiritual realm is, you see, one of the very close things that scholars of Islam have discussed is al-waswasa. So They translate it to Islamic OCD, Obsessive Compulsive Disorder. Scrupulosity. Scrupulosity. So, scholars of Islam have discussed it. So what is different between normal doubt? You know, what's that is you're having doubt. You have the behavior that something want to happen to you. Thinking of it, but the thought is coming. The difference between this normal doubt and the waswasa is diversion. It affects the functioning of that particular person. Normal doubt arises occasionally. It comes once in a while in the mind during religious rituals. Some during prayer. Have I observed 2 rakah or 3 rakah? Have I washed my hand or not? Once in a while. And that is it. That's why another school of thought suggests that repeating the acts when doubt arises for precaution to the people. When you are doubting, have I washed my hand or not? Another school of thought said that you should wash it. Wash it. So we are safe. So it's a precaution. A precaution to be taken. Is it? Scholar says, are you doubting? Is it? Have I observed 2 rakah or 3 rakah? You make it 2. And you are sure. And you continue. And you do the same. Possession of forgetfulness. But the functional rumination that is repetitive and that is excessive doubt, it comes that become pathological and interfere with one's daily life. And religious practice. And that is what you're talking about. If this was WhatsApp, so it's diversional, that interferes with one's daily life, then the analyst advise that. So against these repetitive rituals, when one is in charge, that we should, it's due to potential pathological consequences of excessive repetition of this particular issue. And that is what's WhatsApp. So you base it on, yes, I've done one, I've done this, I've done one, you continue. This waswasa or scrupulosity, according to the Islamic terms, is seen that to some other scholars, yes, they are too, they see it as OCD, Obsessive Compulsive Disorder, because it's obsessional thought. And one engaged in particular rituals. Doing it, we have some that they perform ablution like many times. They believe that they are, yes, it's smiling, it's vitiating, they are farting, they bring out wind. They continue performing ablution to the extent that they will miss the congregational salah. And that is what scholars explain as regards the what's so it is expected to be, yes, there are some certain inventory, psychological inventory tests that can be used to also to diagnose it. To know that yes, this is the aspect. The scholars of Islam has also done something on it. And one will feel to be able to know, yes, is it waswasa, is it OCD, and what is the level. And also it is treated according to some use medication, and we use psychotherapy, we use it to CBT, cognitive behavioral therapy, CBT, is the integration of Islamic Islam here can be used. We look at the nerves, the aklu, integration of the nerves, the aklu, the soul, the mind, the ihsan, also be involved in also understanding whatever usual. So Islamic therapy for CBT involves combination of spiritual and psychological approaches. So you want to treat it generally in Islam, you combine the spiritual and the psychological approach. As we are looking at it from the psychological approach, we are looking at it from the spiritual, from different decree, askar, salat, we even engage in ruqya for that person. Ruqya, if you engage, so then Islamic counseling come in patience and trust in Allah, and also awareness of harmful practices. These are some of the things that scholars of Islam and psychologists also profound in dealing with the O waswasa, OCD in Islamic terms.